Hello everybody. I know it's a little difficult to hear with the muffled mask. I'm going to demonstrate how you're supposed to take off the mask. I have my bottle of Purell here, so before I take my mask off, and we're going to talk a little bit about masking here today, that's why I'm doing this. Before you take your mask off, you should wash your hands so that you don't contaminate your mask if your hands are contaminated. And once you do that, then you take the mask off by the loops, and you can set it in a safe place. So with that, we're going to do a little bit of an update about where we are. Things have not changed much at Holzer in the last week or so. The county numbers and the surrounding county numbers of COVID positive patients are pretty much the same that they've been. We have 48 confirmed cases in our service area, and that's 7 counties, so pretty much all the counties are in single digits. We have tested 298 individuals at Holzer, and we are still open for business and taking care of patients. We do a lot of telephone visits now. We are doing many more of our visits by virtual means using a program called Doximity, which allows us to do FaceTime, real-time video type visits with patients, and we are doing the things that we've been doing, and things have not changed very much. The most recent thing that we have done is instituted a masking policy within Holzer. So when we check in the mornings and are screened, we're all wearing masks. If we don't have a mask, we're given a mask. That's for the employees. We are asking all of our patients and staff to have a mask when they get here if possible, particularly our patients, and if our patients don't have masks, then we give them one as well. It's important, one of the important things about the masking process is we are able to reprocess many of the traditional surgical masks as well as the N95 mask, and so we don't discard those, but it's important for ladies particularly, do not wear makeup if you are wearing a mask. It's very difficult, if not impossible, to reprocess the mask if you wear makeup and they are contaminated with the makeup. So, joining me today is Bill Pfeifer, our Manager for Infection Prevention and Control, and he's going to discuss some guidelines about wearing the face mask, a little bit more detail than what I just did, and how they can help our patients, visitors, and staff. So welcome, Bill.
Thank you, Dr. Canady. Yes, we are currently following CDC guidelines and ODH guidelines for face coverings. One of the things that they have put out there is that face coverings are important for source control. And source control really means that we are protecting each other from our own droplets and secretions. We are recommending this for all patients, visitors, as well as all of our employees. Anybody that is over the age of 2 should be having a mask on if they can tolerate that. One of the things that we really want to stress is that droplet secretions from sneezing, coughing, and talking are what we are trying to prevent from spreading. So my face covering protects you, your face covering protects me.
Please know that the masking policy we put in place is for your safety as staff and for the safety of our patients. So please help us when you come into the facilities, go ahead and have a mask available. If you're interested in helping us and making more masks, I'm going to give you a number to call, 740-441-5005, and find out how you can either donate or help us with the masking efforts. So Bill, have you got anything else that you'd like to add?
Well, yes, hand hygiene is extremely important in the prevention of the spread of infection. One of the primary ways that we contaminate ourselves is touching our face. So if we perform good hand hygiene, that goes a long way in protecting you and your family members from the spread of COVID-19. Thank you.
Thanks, Bill. Again, we believe healthcare closer to home is the best kind of healthcare you can get. We are providing healthcare every day. We want to be your front door to healthcare, and again on Friday we'll be doing a Facebook Live event, so you can join us there, submit your questions if you have any, join into the conversation. And in closing, I'm going to, after I finish, demonstrate how to put the mask back on, but again, if you need healthcare, we hope that you stay close to home with Holzer. So we're gonna, before we put the mask on, hand and soap and water is just as good as the Purell, but that's what I've got right here at the table, so I'm going to use Purell, and I'm going to let it get all over my hands and dry, and then when I put the mask back on, I'm going to grasp it by the side put it on the face and loop it over my ears. So thanks everybody.